Good morning and welcome to the San Francisco Interfaith Council online briefing for community and faith partners. In today's program, we shine a light on one hospital's COVID-19 experience and vaccine outreach strategy to the AAPI community. A special thanks, the San Francisco Interfaith Council online briefing is supported at Sierra Health Foundation. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. For chat, to submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the host and answered time permitting. For closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. The San Francisco Department of Public Health urges people to be ready for COVID by staying up to date on their vaccinations, knowing how to reach your doctor, keeping a supply of rapid COVID tests, keeping masks handy, planning ahead for a possible infection, and staying informed with trusted sources of information such as sf.gov/COVID. Now is the time to stand together, San Francisco. Together, we can stop anti-Asian discrimination, bias, and hate. The virus has no identity. It is just a disease. Now, at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for community and faith partners. At the outset of the COVID-19 pandemic, the San Francisco Interfaith Council was invited by the Center at Sierra Health Foundation on behalf of the California Department of Public Health to assist in its vaccine outreach campaign to our city's 800 communities of faith and religious institutions. The success of the SFIC's efforts led to a subsequent invitation to partner in the more targeted vaccine equity campaign, with a particular focus on BIPOC and other vulnerable communities. This week's online briefing for community and faith partners, hosted by the SFIC, welcomes CEO of the Chinese hospital in Chinatown, Dr. Jian Zhang, who will report on the unique healthcare facility's COVID-19 experience and its vaccine outreach strategy to our city's AAPI community. As we do in each of these sessions and briefings, I will at this point read the interfaith statement. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. At this point, it gives me great pleasure to introduce friend and colleague, Mike Lee, the Executive Director of Cameron House in Chinatown. One of the roles of the San Francisco Interfaith Council is to convene the CEOs of the major faith-based social service agencies and to act as their advocate. It's been a blessing to come to know Mike, and I think we met at the very beginning of your tenure at Cameron House, and what impressed me was the deep faith that you brought to your new position, and I thought it only appropriate as we are journeying into Chinatown today that we invite you to offer the reflective moment to ground us for this presentation. Thank you, Mike.
Thank you, Michael. Thank you to all of us for this morning of gathering, and to our interfaith partners and friends and colleagues. Reflection, from the Latin I learned, means bend back. As a spiritual practice, we consider what's transpired in our lives and open our minds and hearts to the moments of mystery and the living presence of God. You know, on reflection, two passages have had pretty amazing impact on my life, my values, and my choices. The first is one from Ephesians that reads, as a prisoner for the Lord, I urge you to live a life worthy of the calling you have received. Be completely humble and gentle, be patient, bearing with one another in love. You were called to one hope when you were called. For me, this was an idea of grace being, the grace of being called, that one's calling is a testing ground for leading a worthy life, an opportunity of discerning, making soulful choices that, if one believes, allows one to walk a path closer to God. How do you know you're on being called? Is your heart open to hearing what you're called to? Would you believe and acquiesce to the divine? So as the poet Mary Oliver posed, what is it that you plan to do with your one wild and precious life? 3 years ago, I began my work at Cameron House, whose mission for nearly 150 years empowers the San Francisco Chinese community to build strength and resilience through family-centered programs. Our vision is a safe and healthy community where people learn, heal, and thrive. I love walking through Chinatown. It's a place where my grandparents made their home and created community. I walk past the sites of their old businesses, the homes where they raised their children, my parents. And I walk past Old St. Mary's, where my aunts and uncles were schooled and married, and where my parents baptized me into the Catholic faith. I happen to grow up in the suburbs, largely removed from Chinatown, but I've held a lifelong interest and fascination of who I am as a Chinese, and to understand better my heritage. I believe my faith, my professional and personal experiences prepared me for being called to Chinatown. I believe it is a calling. What compelled me was the idea of returning to a place of giving back to a community that supported my family and thriving. Here we are at this pivotal moment in history. We're seeing both a world unraveling and a world building a life-sustaining state simultaneously. We're in the midst of a new normal, if you want to call it this, one that's also shaken us to the core with violence, injustice, and racist acts against Asians and our brothers and sisters and folks of every creed and color, and the crises of mental health, the widening gap in learning loss, and a sense of hopelessness among our youth. The second influential passage in my life comes from Matthew, the Beatitudes, from the Sermon on the Mount, a state of great joy, as I like to refer to it. It reads, "Blessed are the poor in spirit, for theirs is the kingdom of heaven. Blessed are those who mourn, for they will be comforted. Blessed are the meek, for they will inherit the earth. Blessed are those who hunger and thirst for righteousness, for they will be filled. Blessed are the merciful, for they will be shown mercy. Blessed are the pure in heart, for they will see God. Blessed are the peacemakers, for they will be called children of God. Blessed are those who are persecuted because of their righteousness, for theirs is the kingdom of heaven." Where I've discovered this coming to life is through our wonderful staff and volunteers at Cameron House and those in our community who seek to advance social justice, inclusion, and equity, and forge the work of healing, building voice, and empowering. For generations, people come to Cameron House with some need or desire. It may be that they're anxious, depressed, hopeless, hopeful, isolated, wanting to reinvent themselves, heal and build their lives. We support people and families from their places of strength and abundance. It's through service that people discover their radiance, their agency, and build their resiliency. It is the work of becoming, really, growing and evolving. The poet Rainier Maria Rilke captured this best. I live my life in growing orbits, which move out over the things of the world. Perhaps I can never achieve the last, but that will be my attempt. I am circling around God, around the ancient tower, and I have been circling for 1,000 years, and I still don't know if I am a falcon or a storm or a great song. Thank you.
Thank you, Michael, and bless you in what I think is an important ministry in Chinatown. We are very fortunate to have with us today Dr. Jian Zhang, the Chief Executive Officer of the Chinese Hospital in Chinatown. Thinking back to the nascent days of the COVID-19 pandemic, when we were all trying to figure out what this thing was and how we should respond, there was an added challenge. And I remember picking up the phone late one evening from the leadership of the Chinese for Affirmative Action and being asked to sign on to have the Interfaith Council sign on to a statement condemning the anti-Asian rhetoric that was coming from all places, our federal government at the time. I can only imagine the added burden this heaped upon our local AAPI community. And so today, in addition to sharing with us, the experience of ministering, if you will, medically to our AAPI community in Chinatown, and as well as the vaccine outreach you've had and the uniqueness of the challenges, I'm hoping, Dr. Zhang, that you can also share with us a little bit about what it was like to do it in this context of a federal government which was spewing this sort of rhetoric. We are grateful to have you with us, and we are looking forward to this unique window into your community, which only you can offer at this point. Thank you, and the floor is yours.
Thank you, Michael. I'm going to share my screen. Can you see my screen now?
Yep.
Wait, let's see. Great. So I'm Jian Zhang, CEO of Chinese Hospital. Today, I would like to really thank Interfaith Council for giving me the opportunity to share our experience. And it's so important to me, I think, really to share what we've been through. I think that really I want to share my personal experience a little bit first, because I talked to Reverend Fong the other day, and I said, can I share my personal experience, like what I went through during the most difficult time? And he said, go ahead, it's good. And so he's always encouraging. He's such a role model to me. And I went to him all the time for community issues and things like that. And then especially faith. Like to myself, was I scared at the very beginning when we didn't know anything about COVID-19? And I have to tell you, yes, I was. How did I get through this? I start my day every day by praying to God to give me strength, give me courage, give me wisdom, most importantly, and to so I understand what is coming, and give me the wisdom to make the most difficult decision and every day, especially at the very beginning of the pandemic. So I'm so grateful. I was invited to present so many times in different conferences and things, but this one, I think it's, to me, it really touched my heart because of the faith community, because I didn't get to talk much in this field. And then I feel like, you know, you all are really good leaders and public speakers. So I'm actually a little bit nervous. You probably can tell. So the reason why I put this topic as a leadership during crisis, it's not talking about me only, or my organization only. I think during the pandemic, we need a lot of leadership, right? You don't need to be on certain position to lead. And I witnessed a lot of leaders pop up during the pandemic to really lead and then make a huge impact in the different fields. Faith, I really want to talk about it a little bit later, is so important during the pandemic, because especially during the shelter-in-place order, when everybody was confined at home. And so having that faith, it was so important for many people, for me too. So we know that we could get through the dark time, because we didn't know much at that time, right? We didn't know what was going to happen. We didn't even know what type of virus COVID-19 was. So that's why that really the panic reaction and the fear was so immense, and it just that a lot of people couldn't even get through that. So having faith is so important to all of us, I think. So that's why I'm really grateful for this opportunity. So today I'm going to share Chinese hospitals experience and the success, of course, and then the lesson learned and the challenges more so. I really want to. So first, let's start with really, I want to bring you back to beginning of 2020 and in January. And really interesting, that year, Chinese New Year was in January too. Remember, Norman, it was January 25th, right? And so at that time, we were watching China in Wuhan had the huge outbreak of COVID-19. And so my classmates, and I came from China originally, was deployed to Wuhan to help out, you know, to really, she led the 52 bed ICU unit in Wuhan. It's like a temporary setup, and then they took care of the most really sick patients, and really and they did very well. So I got a lot of my information actually from her and from other colleagues there. And because we didn't know much about the virus here. And so I read information from actually China, or talked to the colleagues there more so. And so here in San Francisco, everybody thought if we have an outbreak, it was going to be in Chinatown. And because San Francisco Chinatown is the second most densely populated area in the nation. And we have so many single room occupancy housing, you know, many senior residents here with underlying medical conditions, right? And so it really, it's the area at very high risk of an outbreak. Other people saw so, we saw so too. So I think, Norman, remember I talked to you, say, how are we going to reach out to the SRO residents? And then it was right at that time, I think Norman was in transition of his position, and then he encouraged me to talk to the new ED, and so I did too. Then we kind of worked a lot on that at the very beginning to prepare a proposal to which I submitted to DPH early on in 2020. And so that was kind of our model. I will show the model later on. So we were at very high risk. And then so we were like, what we're going to do to prevent the outbreak. And when I toured the SRO with the Supervisor Peskin, we look at each other like, how are we going to do this? And if we have an outbreak in San Francisco, Chinatown, it's going to be a nightmare to me and you, I told him. And so how we kind of at that point started this a really early prevention and like a lot of community outreach, and I'll share the model. And before I do that, let me share a little bit with you about Chinese hospital. And it kind of really tied to a lot of the anti-Asian hate crime during the bubonic plague early on and the COVID. So Chinese hospital was established back in 1899 when a lot of overseas Chinese came to the United States to build the railroads. And when they were sick, they were not allowed to access the mainstream hospital. And that's why the community got together and built the Tonghua dispensary. And right after it was open, bubonic plague hit San Francisco. And at that time, it was way worse than COVID-19, said that Chinatown was quarantined. They actually built walls around Chinatown to prevent people from going in and out. Who was taking care of the Chinatown community at that time? Apparently, Tonghua Dispensary was the only healthcare facility in Chinatown. And so it did a lot of work. So I just found out an article written by Professor Rees at UCSF, which was published in 2011. And it talked about in detail about how Tonghua Dispensary was established and what it did during the bubonic plague. So basically that they went through this Chinese at that time, they were not allowed to access anything else except Tonghua Dispensary. So Tonghua Dispensary at that time stepped up, not just to treat patients, and they also did a lot of the public health work, like what we did during the COVID-19. Same thing, then they didn't have resources apparently, right, at the time. And then a lot of the panic reaction within the community. And so that's kind of like back in the early 1900s. And sadly, during the earthquake of 1906, then Tonghua Dispensary was totally destroyed. And the community got together later and built the real hospital, the original hospital, which was opened in 1925, the Chinese hospital. And so that was really showed the collaboration of the community and all work together building the hospital. And really make a huge difference of providing culturally sensitive and linguistically competent care to the community for over 120 years now. And in the 70s, I think many of you know that we used to have a lot of community hospitals like French hospital, German hospital, Jewish hospital, and they all were closed and in the 70s because of the seismical requirement. And so at that time, the community got together again, fought for Chinese hospital. And so for the state to help Chinese hospital, and our community hero, Rose Pak, led the fight, right, to keep Chinese hospital. So luckily that the hospital was saved. Then at that time, they converted the 79 building, which was supposed to be a clinic, into a hospital. And so my work actually then from 1996 to almost 20 years of my life building all the community clinics and the outpatient centers for Chinese hospital, which really was very rewarding to me to add a lot of the services to Chinese outside of Chinatown. And so a lot of more outpatient services. And during the pandemic helped a lot too in giving out testing and vaccines. I'll talk about that later. And so in 2016, we actually built a brand new hospital. So now we have, the hospital is 4 times bigger. It's a lot better. It's a 4-star hospital. And I'll show you more information. I know that we don't have a lot of time. So as a leader, I guess for all of us, and we look at in Chinese, crisis equals danger plus opportunities. And I think what we did here in Chinese hospital during the pandemic, instead of being scared by the danger, we took it more so as the opportunities, what we can do to protect our community, right? So that's why I think that's the approach we took. And so at the very beginning of the pandemic, as we were all facing that unknown virus and we didn't know what was going to happen, we quickly changed our organizational goal to really the number one goal. I told all our employees and physicians and the providers that number one priority is to protect our providers and staff. So only when they are safe, they can take care of our patients and our community. And so, and the second one, of course, is to protect our patients and family and safeguard the community and to prevent the major outbreak and control small outbreak. We knew that we were gonna be hit. We knew we were gonna have outbreak. Like how can we prevent the major outbreak and control the small outbreak was kind of the approach that we took. And a lot of challenges, of course, at the beginning then. And you probably remember when shelter-in-place order was implemented, it's good to protect the public, but for hospitals, that also means that we didn't have income because all the elective procedures were canceled, and we didn't have income, but we have to do more, and so we have to really very, very short of medical providers and especially specialists. And then a lot of physicians' offices were closed. So you probably remember a lot of the Chinatown at that time, it was so quiet. It was so scary that, it feels, but Chinese hospital was only place was open 24/7, right? And so safety was another issue to us. So that's why when I pray every morning, I pray for the strength and the wisdom from God, so I make the right decision. And the other thing is really to pray for the safety of our employees and our providers. And then so that's kind of really a scary time. And then lack of PPE was the most, I should say the worst nightmare of me as a CEO, because how do you protect your providers when you don't have N95, right? Remember at that time that all the shelves in CVS and Walgreens were all empty, right? People panicked, they bought everything. And then so for us in the hospital, that N95 was so short. So I really creating the pathway to get the PPE, to get the N95 to protect our providers was really, really difficult. So anyway, another time maybe I'll share the story about how we created the pathway to get there are many people to thank at that time, and so to get the people help me to work with manufacturer to get the PPE, and then there's people. A lot of people help us, organization help us to get it here from China, or the logistics, the transportation and everything. This is very, very difficult. So we got that, and we're so proud actually And Chinese hospital was the only hospital that our providers and staff didn't have to repeat use N95. And we didn't have a hospital-acquired infection either. And so that was kind of something that we were really fortunate and very proud of. This is the model that we use, right? And really, for us, you can tell Chinese hospital at the time took the lead, but we work very closely with the city, with elected officials, with community leaders like Norman, and then our Nichols, and which is our community partner, and so self-help for the elderly, and UCSF, and the first SRO testing, in the community that actually was the first 500 swabs was from UCSF. Like, you really, I mean, a lot of them, that we're a small hospital, we didn't have we didn't have resources, like we couldn't even do the PCR testing, so we had to work with UCSF, and then they really help us with that. And then later on, then it was all kind of supplies that were really, really short, including the swab. Normally, you wouldn't even think about that. At that time, we couldn't even get that. And so the community leaders and the media, and then the media was at Chinese hospital all the time. And then like we rely on them. We find out the information because information was evolving every day. We did sometimes that we didn't know much, and then the new information come out, and then we rely on the media, and they took it out to the community. And so we did a lot of, we created our hotline, and bilingual hotline and bilingual educational materials very early on. And then so the media helped us to the community too. And we went to the community and give it to the community organizations, and for that too. I'll talk a little bit more about that. And then for safety, but we work very, very closely together with our police department to make sure our employees are safe and make sure our patients are safe too, right? And so SRO building owners and managers, oh my God, I mean, like it really is so important. And I'm going to give you an example how important it is to work together with them. And so you probably remember that Chinatown had that one outbreak on 777 Clay Street. And so that's one SRO that, because at the beginning there was 3 positive cases, so the DPH was doing the outreach, and then they couldn't find the building owners, couldn't find the managers, and then later on there was like other reasons they couldn't get to that SRO. There's only 22 units. We ended up with 14 positive cases. I'm sure that Norman remember that. And then there's a panic reaction. And then so the people say, oh my God, don't go to Chinatown. Chinatown is having a huge outbreak now. And like all those rumors are all over. And then so we have to, went in right away to help our board members, because some of them born there in Chinatown, grew up there all their life in Chinatown, so they know every building, like who's the owner, who managed that. So we were able to get in. And then so we started doing all testing for all the residents, and then did the contact tracing, quarantine, and the linkage of care. And all those things were done then, so we were able to control that outbreak. It didn't get to other part of Chinatown. So it's very, very important that, say, for later on, we'll talk about how do we, collaborate, work together. That's really, really important. So in the middle column, you can tell that what we did, that we provide the education, everything bilingual, and the bilingual hotline. At the beginning, we have 2 staff. Ended up when it was we increased to 6 staff, it was still not able to answer all the calls. People were calling not just from San Francisco, they're calling from all over the country because that's probably the only bilingual hotline they could get. And so that was, it plays such a critical role. So we continue that, we still have that. So access to testing, contact tracing, quarantine is really important. And the other thing is that to really connect the positive cases to proper care right away, and then do the contact tracing that right away. All those early everything. I think it's a really, I'll talk about that when we share the success. And then track the vulnerable residents through the platform is so important. I think that working in the future, I think of what like a Interfaith Council or, you know, those, a lot of the community associations can help out, like support those quarantined individuals, because mental health, behavioral health became such a big issue during the pandemic because of the isolation, you know, all those things. And I think that's when faith is so important. Like we can reach out to those people quarantined and then give them hope, right? I think that faith community play a really important role during the pandemic is that you give people hope. And then so give people faith. They can get through this together. That piece, I think we work with the churches, work with community associations, did a lot of outreach there too. And conduct cultural relevant outreach activities that we did a lot. Our employees actually carry the pouch and so go to the seniors home to give them vaccines or to do the testing because they're so scared they don't even want to go out. And of course the anti-Asian hate crime definitely make it worse because they attack our employees. Our employees, when they were taking public transportation, got yelled at, tell them to go back to China, and then they got hit too. They used the can and then hit our employee. And then also our patients got attacked. That's why the seniors were so afraid to come to the doctor's appointment or for testing or for vaccine. So we ended up going to the senior housing to give them vaccines, knock on doors and then give them testing or vaccines. So that's kind of like, and then we open up not just the hospital in Chinatown, we open up all our satellite clinics for walk-in clinics for vaccination. So that's why later on you can tell that our vaccination rates in Chinatown and got to above 80% very early on. And I think that also helped too with the low infection rate, right? Because they were all vaccinated. So this model was actually adopted by DPH, and then they said it was disseminated to other community and through grants and back in 2020. And so this is the specific timeline, like what we did. And you can tell that my team is very good in keeping all those things. I'm not going to go through everything, but I think a few things to point out is this in January. Actually, very first time I talked about COVID-19 was back in January on media. It was on January 29th on KPIX. And so at that time, I clearly remember that COVID-19 wasn't airborne yet, that CDC was saying that it was joblet, if you remember that. So we didn't even dare to tell the community to wear a mask because there was no mask, right? Remember the severe shortage of masks. We told people to, and the second picture here is it's actually a press conference at CCBA on February 1st that we started to give our bilingual educational material already there. And then so we taught the community to how to wash their hands, clean the don't touch the elevator buttons or SRO residents at the time, we started teaching them and to clean the kitchen, don't cook together, and how to clean their bathroom doorknobs and handles and things because they share, right? And so that kind of, we did a lot of early education at that time. And so I think that really helps to educate our community so they don't get panicked, and they know how to properly protect themselves. So that's what kind of we did early on. And I also want to point out one thing, because we knew the community, when they get panic reaction, they wouldn't dare to, I mean, they you know, to come to the hospital. And so we have to go to them. So very early on, we knew that. So I submitted the proposal to many organizations. And then the first organization responded was SFIC Foundation. And it gave us, I've been with writing grants for 25 years. Very first time I got this $250,000 grant from SFIC Foundation within 3 business days. Can you believe it? So that for us to create that mobile unit, the tent, and then, you know, those things are needed to go to the community to do education, to do testing, and all those outreach activities. So they really appreciate the support from SFIC Foundation, and later on many other. So you can tell from here that in April, that we also elevated our ED to basic services, so we could receive more sick patients. And then we opened our second floor, get licenses, so we could help San Francisco General Hospital to we take patients from San Francisco General Hospital, so they could take care of more COVID patients too. So we kind of expanded the bed capacity, and then we have our donor donated $1 million to help us open up that floor at that time, and they also donate money so we could get the other really important equipments like the moonbeam to sterilize the rooms, and then glide scope to really how to safely intubate patients. And so I guess because of all those work, you know, what the community did together, then, you know, in April, New York Times came to, everybody got I guess, curious at that time. Everybody was expecting a huge outbreak in our community in San Francisco Chinatown, but it didn't happen. And we got a lot of media coming in to you know, to kind of wonder why it didn't happen. So I think the first one really was New York Times in April, and to wrote that article about San Francisco Chinatown, and really ask what we did. And so that was the article. After that, then we got a lot more other media coverage. I think it really helped us to get information out too. And so we started the SRO testing. We wanted to do it earlier, but we couldn't get the supplies to do it. We were fighting really, really hard to get the supplies to do the SRO testing. But finally, we were able to do it in May. Then the first community testing, and that really helps, I think, with that going to the community, knowing that we actually didn't have. People were wondering, maybe we do have more infections, and then we just didn't know because we didn't do testing, right? So after we did the testing, we knew that we actually really didn't have the infection, because that it came out. The first one we did testing was O negative. We did, and so we continue to do that after that. It was kind of really good now knowing that we actually didn't have the infection. So as of August that Chinatown was one of the areas with the lowest infection rate. And then we were very happy that, you know, we actually didn't have the outbreak here in Chinatown. So I'm not going to go through all of them. Apparently, we continue to do the community testing, and then later on, we started the vaccine actually in December 2020. Then, you know, we went to the community and opened up all the clinics to do the vaccination. And so you can tell the first picture is that the staff carrying a pouch going to knock on a senior's doors to give them vaccines. And then apparently that we joined the protest and to really denounce the anti-Asian violence and, you know, the hate crime. So we were very much part of that. I give a lot of talks about that. COVID-19. I like the message that you give out. COVID-19, it's a virus. It's a disease. It doesn't know your color, the color of your skin. It can infect anybody. Apparently it did, right? So it had nothing to do with the like you're Chinese or your other whatever, you know, it can infect anybody. So that's why so we did a lot of that education, and so that then we continue to do all those community outreach event and vaccines. So this is the comparison of the bubonic plague and the COVID-19 infection. Really similar to both public crisis, that the public's reaction and the fear, and then because of that, then they blamed Asian or blamed Chinese for bringing in the virus or the bacteria, and so have that violence against the Asian community. And so Chinese hospital in both events took the leadership and really did the public health work, help prevent the huge outbreak and help control the small outbreak. So this is very, very similar. That's why we kind of put that together. And so this is the numbers, I guess, then we administered. At this point, this is as of November. By now, I think we administered probably over 60,000 vaccines. And then we performed over 40,000 tests at Chinese hospital site. As you probably know that in Potsdam Square, no one knows, right? So we're still doing the testing and help with the Potsdam Square testing too. And that testing site is not just testing residents in Chinatown. That's a citywide. Actually, we provide tested to everybody who come to the testing site. And so we managed the more than 30 SRO buildings with positive cases, went to manage that and control the outbreak. And so, well, we should say that we really provided all the care, and so we could control the outbreak. So we distributed more than 210,000 rapid testing kits to the community, and we really work together. Whatever resources we received, we share with the community. The mask too, right? So we got donations later on, then we share with the community too, to make sure our community have enough resources to fight against the COVID-19. So very early on, we reached over 88% of the vaccination rate. And so our infection rate and mortality rates still remain very low. Very proud of that. So I'm not going to go through everything. I think I want to talk about a little bit this slide, that the key factors to success. And I was asked a lot about this. And I think early prevention through community outreach and education is very important. Early testing, timely contact tracing, quarantine, linkage to care, it's very important. And partnering closely with the community organizations like, the SRO, owners or management and other community. And then it's super important. So meaning that nobody during a public crisis can do it all. No single organization, we can't just blame DPH or nobody could do it all. So we just really, entire community need to work together and play an important role. And just like a faith community that you really can help give our community hope, right? Like especially when they're when they are isolated, that faith is so important. So I think in the future, we will definitely can work more together, helping, like having our own health system. It's very important. Having the culture sensitive and linguistic appropriate care, because like if they can understand you, there'll be panic, right? So they can follow the instruction. And then having the Chinese media system also really help too. This is a kind of like all the this is the bilingual educational material we developed very early on, and we developed things as we need. Like later on, when the self-testing kit come out, we provide videos, and then other things like we keep adding to it, like whatever evolved, that we create new bilingual educational material to the community. And then so a lot of the media coverage for the there's, I'm not going to go through that. That's all in there. Then we got a lot of recognition. Greatly appreciate that. It really encouraged our team, right, to continue. 3 years of pandemic, our teams are pretty burnt out. Healthcare providers are really burnt out. So I think that that's why I kept asking the elected officials, even our board members, whenever you see a healthcare provider, so say thank you. Really, it means a lot to them. If we need them to continue to work, we're very, very burnt out. And so it's and so I'm very fortunately to receive the recognition too. And I think that here I would like to and Chinese hospital is one of the 4-star hospitals in San Francisco, and the other one is UCSF. So we work very closely together to provide healthcare to our community. So I'm going to stop here, and then I know that the questions then, so we can have more interactive discussion.
Dr. Zhang, thank you so much. Your presentation exceeded expectation. It was most comprehensive, and you brought your own faith and passion to all that you said, and we are so grateful. We've asked Reverend Norman Fong, who's a member of the board of directors of the Interfaith Council, as well as a parish associate at the Presbyterian Church in Chinatown, and I would say a force in Chinatown, and a colleague and a friend of yours, to be the respondent today. Norman, I'm going to give the floor to you because I know you have a unique relationship with the hospital and Dr. Zhang, and speak to that as well as ask a few questions.
Okay. Dr. Jian Zhang, I love you. And what you did during the crisis, when the city couldn't outset and the city couldn't get into the SRO, you had to do it, and the whole community. And I just want to say this, you may not notice, but Chinese hospital as the only independent hospital left is so important. And when I was a little kid, I went to Gene Parker Elementary School right on Broadway in Powell. And I got real sick at school. The principal didn't know what to do. And I had no health care, right, as a kid. So I went to Chinese hospital. And I found out I had a bad case of pneumonia. I was only, I don't know, 8 years old or whatever. And they treated me for free. And so I'm always especially thankful for Chinese hospital and actually I'll just say it out loud because you got to be nice. I don't have to be that nice. I think the city is lucked out because of a strong community led by you and all the health providers. They did not, when you told me I went to get a vaccine and it wasn't covered by the city, I assumed it was covered by the city and you had to get foundation grants. And anyway, super congratulations to you. My question is twofold. One is, how has the living through the pandemic help you lead it into the future? Like, what's next? And then the second one is, how can we help maintain this independent hospital to keep going and serving our community? Back to you.
Thank you. Thank you. Yeah, it is. I talk about the challenges, right? As yeah, and thank you for saying, yeah, Chinese hospital is the only independent hospital left in San Francisco. And you probably heard that after 3 years of pandemic, California hospitals, and we kind of like really, we could say that healthcare is in financial crisis. And then so Chinese hospital being the only independent hospital, apparently that we struggled a lot, right? Because a lot of the vaccine itself, Norman, it is free. It is covered. It's free for everybody in the country. And then so a lot of other things. Yeah, I know that you asked me whether I got funding from the city to do all this work. And so no, you know, it's not blaming. I mean, like, you know, again, I think that we all try to work together and so to help the community. And so it's Chinese hospital is not a city-owned or government-owned hospital. Is independent, and so it's financially that we well, it's that. Let me explain this kind of in a better way. So we mainly take care of Medicare and Medi-Cal patients, right? Meaning that Medi-Cal is for low-income people. So every dollar we spend to take care of not just us, right? It's nationwide. Every dollar healthcare spent to take care of a Medi-Cal patients, Medi-Cal reimburse 74 cents. Meaning you take care of Medi-Cal patient, you actually lose money. And then so Medicare patients, they're not that much better. They reimburse 75 cents. So you lose 25 cents to 26 cents per patient you take care and per dollar you spend. And so for other hospitals have more commercial patients, meaning wealthy patients, then they can offset that cost, right? But for us, then more than 90% of our patients are Medicare and Medi-Cal. So that's why we have to raise money. We write grants. We do all kind of things, you know, fundraising activities to make sure a Chinese hospital can continue to sustain, so we can provide that most needed care to our community. And you're right. I mean, during the public health crisis, or now not even that. I mean, we really should get support from the city or from the state or from federal. So we're working on that. The city, it's you know, kind of like you can tell that we have been working very closely. And I think the pandemic exposed more of the need that how do we, you know, how important the hospital is to the community. It actually can help the city too, right? During public health crisis or in general, right? We can do a lot to take care of the community, and which we do. I mean, you can tell that we really, I think that if the community need to work together. And sometimes I don't think people understand the community. Chinese hospital is a community hospital. Nobody owns the hospital. It belongs to the community. So if the community will all get together and support their own hospital. The best way to support the hospital is by using the hospital's services, actually, or the clinic's services. And that would be some that join the health plan, right? So we can take care of them, and also they can take care of their own hospital. I think that's kind of something that we can do as a community, work together to make sure that the hospital sustain. And another thing too is that we work together and plan together for in case of any public health crisis. It could be earthquake, it could be another virus, it could be another disease, or whatever hits, then the community can step up and work together. I think that we learned the lesson learned from this pandemic is that we all need to work together, so we can what I call safeguard our community. It's just that every organization play a pivotal role in this, right? And as we can tell, I mean, like I didn't know there was an interfaith council. Now I know. Later on, if I have
Look
a
out,
patient,
Michael, look out.
I would say, this is my patient who's isolated at home. Can we have some, like someone to help the patient, give them faith, give them hope, and then that would be really helpful, I think. And so that's kind of like for the future. And yes, the Chinese there are other ways to support the hospital. Fundraising, like a donation, is one thing, right? There's many other ways too, and the volunteer would be another way to do it. There's many ways we can do together. And I already asked Norman to be our advisor, like how we can better work with the community. He knows every corner of Chinatown, and he knows everybody in Chinatown too. So I think that there are many ways that we can work together and then or help the hospital. Did I answer your questions?
Yes, you did. Thank you so much. I know, Michael, time's up, right?
Michael, you are muted. You're muted, yeah.
Although we're out of time, I do have one question, if you'll permit me. Dr. Zhang, there's been a lot of interesting news going all around the country about the vaccines themselves. You're in a very unique position because you're a bilingual hospital and be able to communicate with the community. Did you find any resistance from the community to becoming vaccinated?
Yes. Because there's so many misinformation out there, people worry about the side effects and they worry about, and some actually have people's belief too, then they said that they have to have trust in God. They're not, they don't want to get the vaccines. So I think that maybe it's the area we can work together to educate people too, right? Yes, we have faith in God, but this is that scientific piece that we need to believe too, right? And then so for us, and then safety, like I said, the biggest challenge that we face is that a lot of our seniors didn't dare to come out of the house during the pandemic because of the anti-Asian hate, and then because of violence, they got attacked. And so we ended up have to go to patients' house to give them vaccines, which is very, very sad, right? Or then we work with, when we have clinics, we work with the police department, say, can you work with us? So we want to provide this walk-in clinics, and then, to make sure our patients are safe. So I think it's a lot of efforts were being done. So that's why we were able to reach 88%. And although there's still, you can tell, they still have some people really cannot get it because of medical condition or things like that. Some others still should get it. They still not getting it, especially the bivalent boosters. and people should get it. So let's still kind of like try to promote that. It's the side effect is very mild. It can protect the mutated strand too. So we really should encourage people to get the bivalent boosters.
Thank you so much. This has been a phenomenal conversation, and I want to let you know that by day's end today, we will be sending out this recording link, and hopefully if you'll share with us your slide deck and any other resources, links for the hospital, we'll get that out to our 5,600 e-subscribers today, and this will have a life also on archival life on our website, so people can come and see it here. I want to thank you both, and thank you, Norman, for making this important introduction. Dr. Zhang, God bless you and your work, and may your faith also help to give you strength and comfort as you continue to minister to the people of your community. We also want to thank Trey Russell Allen, our tech support, and Cynthia Zambucas in our office, and invite you all to join us on March 2nd at 8:30 a.m. when Kelly Younger from the Interfaith Movement for Human Integrity will present on the effects of governors from red states exporting undocumented immigrants to cities such as our own, and how congregations can support newly arrived asylum seekers. A very important and timely conversation. This concludes today's program. We thank you for being with us, and we wish you a beautiful day. God bless you and God keep you.
Thank you.